The best of Money Matters. The Big Story.
Welcome to The Big Story. I'm Hong Bin-jung. Mental disorders are now the leading cause of disability and death among 10 to 14-year-olds in Singapore. A new study in the Lancet Public Health reveals a sobering reality. Mental distress has become the biggest health burden in Singapore, more than any other ASEAN nation. In 2021 alone, over 653,000 cases of mental disorders were diagnosed here, with anxiety and depression, much of it linked to the COVID-19 pandemic. Among the youngest and the oldest in our population, the numbers are especially troubling. Experts point to rising academic stress, the influence of social media, and the erosion of family and community support as key drivers. And while mental health awareness has improved, stigma and access to care remain big barriers. So what's driving these trends and what more can be done to address them? And how do we tackle a mental health crisis that's happening in silence? Well, joining us today to share more is Marie Ng, who is the Associate Professor at Young Lu Lin School of Medicine at the National University of Singapore and an Affiliate Associate Professor at the Institute for Health Metrics and Evaluation. Now, Professor Ng is the lead author in the series of papers and is the first joint research collaboration between NUS Medicine and IHME, which leads the 2021 Global Burden of Disease Study. Hi, Professor Ng. Welcome to the show.
Hi, thanks for having me.
Thank you so much for joining us. Professor, according to the paper published in the Lancet Public Health, mental disorders are now the leading cause of disability and death among 10 to 14-year-olds here in Singapore. What are the key drivers behind this alarming trend among young adolescents? Is there a difference between male and female youths in this age group?
That's right. Some of the drivers of mental disorders, as you mentioned, among young adolescents include social media, academic pressure, changes in our social environment, and also the recent COVID pandemic. There are some differences in the types of mental disorder affecting this age group. So among girls, anxiety disorders are more common, while as among boys, we are observing a higher prevalence of ADHD and conduct disorders.
So what are the kind of mental disorders that are being diagnosed?
Yeah, so within the age group of 10 to 14, anxiety disorder is one of the primary cause of mental health issues, and it followed by ADHD and conduct disorder.
All right. Is there any form of intervention then, perhaps, from parents or schools to help detect or reduce these issues?
At the national level, various initiatives have launched in the past few years, focusing on the mental well-being among youth and also provide ways that parents and schools can support them. For example, the health promotion boards offer a range of resources such as Parenting for Wellness, which provide tips on understanding children's mental well-being and emotional needs. There are also school programs that have been launched to raise awareness of mental health issues. This is a challenging issue that requires the whole society to participate. I would like to emphasize that beyond thinking about intervention, we also need to emphasize on the development of a healthy lifestyle. Maintaining good physical health is crucial for preserving mental well-being.
Professor, you mentioned earlier in our conversation that social media and academic stress are, some of the key drivers of mental distress among the youth. How is social media specifically impacting the mental health of adolescents today? Are you seeing any patterns or online behaviors that are linked to mental distress?
There's a growing body of research that points to the harm of social media on mental health. For example, increase in anxiety and depression due to social comparison, exposure to cyberbullying. Social media also are associated with addictive behavior. We also should remember that social media tend to take away time from rest and physical activity for people both young and old. And then if you recall last year, the United States Surgeon General even proposed including a warning label on social media.
Well, given that social media platforms are evolving so quickly that even parents can't seem to keep pace, is there anything that public health policies can do to help?
This is a tough one. Just as I pointed out, the U.S. Surgeon General last year has initiated this pretty radical proposal to put a warning label on social media and the health harm that it caused, but it has not been implemented yet. I think this is an area that requires more research and study in terms of how do we balance individuals' freedom to access information while protecting their health.
Okay. Well, the study has also shown a sharp rise in mental health diagnosis among the elderly elderly as well, with a threefold increase in cases in those over 70 years old. What factors contributed to this surge in mental health issues among older adults?
I should emphasize that the increase here is driven primarily by the increase in the number of older population, not by the incidence rate. So in the past 30 years, the incidence rate actually have stayed quite stable with only a small increase. But because we are facing an aging population, the sheer number has increased because of the increased number of people. But this sheer number has resource implication. It means that we need to plan for more mental health services for our aging population.
All right. Well, then how does mental health typically manifest in the elderly? Are we seeing more cases of depression linked to isolation, physical decline, or other age-related factors?
When we are looking across age group, we see that typically anxiety disorder began to rise during adolescence and it continued to increase into young and mid-adulthood. But as people age and reach an older age, depression becomes the primary mental disorder. Most elderly individuals with mental disorder tend to suffer from depression. And the rise of depression in older age group tend to be associated with social isolation, physical decline, and also just general change in their circumstances. Physical decline tend to reduce mobility and often limit social participation and increase the risk of depression.
On that note, Professor, do you think the stigma surrounding mental health in older populations is worsening or improving at the same pace as in younger ones?
We don't have sufficient data to determine whether the situation is worsening or improving at this stage, but there is certainly stronger stigma among the older population because of the lack of awareness and knowledge about mental disorder, as well as some persisting cultural and traditional misconception that lead them to view mental disorder as perhaps like a personal weakness that they would not want to seek help so readily. So we really need to continue a whole society approach that cater education not just among the youth, but also across all age groups.
Well, Professor, you noted that the pandemic significantly triggered anxiety and depression across all age groups here. I mean, we're now about 5 years out of the so-called pandemic era. Are you still seeing similar trends as you did during COVID-19?
Because our study covers the period from 1990 to 2021, so we don't have sufficient visibility into the aftermath of COVID-19 yet, but mental disorder tend to have lingering impact and reoccurrence is not uncommon. So we need to continue to monitor this in the years to come.
Okay. Well, another interesting finding from this study is that the impact of mental distress on population health here is the highest in ASEAN. And I just want to compare because according to the Institute for the Quality of Life's latest Happy City Index, Singapore has been ranked the world's third happiest city for 2025. So how would you explain that kind of disconnect? Are we a happy country if we are the most burdened with mental distress among our regional peers?
Yeah. So if you look at the calculation of Happy City Index, it is based on factors that influence the happiness of residents. So it is not a direct measure of emotional and mental well-being. So for example, one of the dimensions used to determine a happy city is government transparency. There's also another dimension that look at environment, particularly how resources are managed. So the assumption of that study is that these social, environmental, and structural factors play a role in influencing people's quality of life. In contrast, our study focuses on the diagnosed cases of mental disorders. And mental well-being is influenced by many different factors. While having a good environment, a strong government can help reduce hardship and reduce some of the mental stress, there are also unique challenges that arise as a country develops and advances.
Okay. Well, is there anything that we can learn from our ASEAN neighbors when it comes to how we can better address mental disorders?
Mental disorder is really a challenge for the entire ASEAN region, not just a problem for high-income countries. In the lower middle-income countries in the region, such as Laos, Cambodia, and Myanmar, youth are also facing very similar burden of mental disorder, although the stressors are different. So in those countries, children and adolescents face challenges such as poverty, food insecurity, and natural disasters. So all of these are significant mental health stressors. So essentially, every country in this region needs to dedicate resource and pay more attention to this public health issue.
Right. Well, the good thing here is that there has been greater awareness and reduced stigma that have led to more people seeking help. Are there particular campaigns, policies, or even changes in perception that have been especially effective in improving awareness? Could you share some examples?
Yeah, we are making progress in Singapore. For example, the Beyond the Label campaign, launched by the National Council of Social Service in 2018, it appears to have achieved some results in raising awareness through education and promotion. And then recently, the National Mental Health and Wellbeing Strategies, introduced just 2 years ago, it also offers a very comprehensive blueprint in addressing the entire continuum of care for mental health. I think beyond raising awareness, another important consideration here for us all is improving access and affordability. We need to make it easy for people to look up for a health professional that can support them in their mental health issues, and also make it affordable and not expensive.
You mentioned affordability there, but is there anything else that can be improved? I mean, what do you think is lacking? What about the cases that go under the radar?
Yeah, I think one of the gaps in Singapore is we are seeing a low capacity in terms of mental health care professionals. The psychiatrist to population ratio in Singapore is quite a bit lower than other high-income Western countries. We are talking about one psychiatrist serving approximately 21,000 people, whereas in the European Union, for example, they have one psychiatrist serving 10,000 people. So we are almost like half the capacity of the other Western country. So improving the health professional capacity will be one of the priority. And then in terms of what you mentioned about being under the radar, this is where I think the monitoring and data collection need to continue to step up.
Some great insights from you there, Professor. But before we let you go here, will the NUS IHME collaboration continue to track long-term mental health outcomes here in Singapore? What are the next focal points for research and policy advocacy?
Yes, we will continue to monitor mental health outcomes in Singapore as well as other countries in the region. We are also going to continue to look more broadly at other high priority public health issues in the region, specifically pertaining to, for example, the aging population and also some of the emerging challenges such as like climate change and air pollution.
Thank you so much, Professor, for joining me today.
Thank you, Hongbin.
Thank you. That was Mary Ng, who's an associate professor at the Yong Lu Lin School of Medicine at the National University of Singapore and an affiliate associate professor at the Institute for Health Metrics and Evaluation. Now, before I end off the segment, here is a public service announcement. If you're struggling with mental health issues or you know someone who is struggling with mental health issues, please contact the SOS helpline via WhatsApp at 9151-1767. That's 9151-1767. They provide 24-hour care text, which is a text-based service that provides emotional support for those in distress. They also provide care mail, which is an alternative avenue for emotional support for those who prefer to write in via email, and you can do so by emailing pat@sos.org.sg. This has been The Big Story with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.